Memory, forgetfulness, and aging. Hi everyone, welcome to my channel. My name is Dr. Purvi Patel. I have Dr. Rajesh Agarwal with me today. He is a board certified internist and a board certified geriatrician. He is also a colleague and we have worked together for 14 years. Today we're going to talk about cognitive impairment, memory lapses. What do we see in the office and what do we suggest? How do we evaluate that? So Dr. Agarwal, tell me a little bit about how we evaluate a patient that comes in and says, you know, I have been having problems with my memory over the last 6 months, or that's what the family has noticed. How do we evaluate that when a patient comes in to our office?
So there are different tools that we use to evaluate memory. There are tests that we can do, like a quick and dirty, which is like mini cog, is the 3-point three word we give the patient, ask them to recall. We can do a clog draw test, or we can do a little more extensive, which is 30-point. It takes about 15 minutes. Okay, you can take 4 or 5 different areas of the brain, whether they're oriented to their surroundings or not. They can remember 3 words and have them recall after like 5 minutes when you're distracted. Can they do simple calculations? Okay, are they attentive or not? And then we test about their language. Can they repeat sentences or not? Right. Can they draw, copy a figure or not? Okay. So these are the simple tests that we usually do to evaluate their cognitions if they have any problems.
Okay. And so let's say somebody scores on any other testing, somebody loses a few points. So what are the other things then that we look at in that patient that comes in for a cognitive evaluation?
So one, we have to always make sure there is a deficit is related to that, for that person, is from their baseline. So if the patient has a low level of education, their score will always be low. So we have to make sure if they come in, the deficiency has to be from what their normal level is, okay, it's their baseline. And there's a difference between the normal cognitive or mild cognitive impairment and when we talk about dementia. Correct. Dementia usually have, like when you have cognitive impairment or memory loss, there has to be 2 other areas of the brain involved. Either patients have trouble with their executive function, like not able to pay bills, not able to drive, have problem with the language, not able to communicate with people or family. Or,
right, so that's the first area that we see deficits in,
right.
Executive functions usually, when we look at mild cognitive impairment, correct?
Right.
Okay. Okay, so, and then what does that patient, you know, so let's say we say they have 3 points or 2 points lost in that test, and we evaluate them for reversible causes. What are some of the reversible causes of cognitive impairment that we look at?
So first we have to look at like anything reversible cause that can be treatable, okay?
Right.
So number one is like hypothyroidism. That's very common in elderly patients. As we age, our glands atrophies, and there are 20% risk of hypothyroidism. So always screen for thyroid hormone deficiency, because if patient has severe deficiency, it can be treated. Second is vitamin B12 deficiency. That is also treatable, but over the years we don't see vitamin B12 deficiency that common, because a lot of my patients are actually taking over-the-counter vitamin B12 supplements. So it's not that common now as it's opposed to be like 10-20 years ago.
Right.
The other causes, like we look at the patient's medication list. Are they taking any psychotropic medication? Because that can also affect your cognition. So especially look at the opioids use, benzodiazepines, those are the 2 important ones.
Right.
And then we look at the patient's any history of drug abuse. It could be alcohol, excessive use of alcohol intake. That can also impair your memory. So
trauma.
And trauma, yes.
Yeah. Like concussions. Yeah. And then as well, vascular changes that can occur in patients that have diabetes, right, or patients that have hypertension. Vascular disease prone patients, so those are the other.
Those are the other risk factors.
Right.
Yes.
And then how else? So imaging wise, how do we evaluate that patient?
So in mild cognitive impairment, again, there are some studies suggesting the patients, if you do MRI scan of their brain, usually particularly you're paying attention to temporal lobe. So if they have a temporal lobe atrophy, That actually...
Temporal lobe is over here, guys.
Yes.
Yeah.
So brain is actually, for those who don't know, the brain is considered like frontal lobe, temporal lobe, parietal lobe, and occipital lobe. Okay. So we're paying attention mainly to the temporal lobe atrophy, which is actually preclinical or precursor of Alzheimer's dementia. We have to pay important. So there are other scans also available, but again, it's not widely available for general population, like amyloid PET scan or tau PET scan. It's mainly used for research and investigational purposes.
Okay. How about diet and lifestyle changes? I mean, at this point, we're seeing a lot of processed foods, a lot of, white sugars being used. Would that have a portion in or play a part into memory loss? Improving your lifestyle and diet, would that help memory loss? If we think, is there a chance to reverse that, or at least, stabilize it where it is? So
there are studies actually, dietary habits do play an important role in the cognitive part, because there are studies actually particularly focusing on people who are on Mediterranean diets. That is, which consists of mainly like fruits, vegetables, and nuts. Mm-hmm. So that's important. Okay. Now, as far as other risk factors concerned, like we know that diabetes is important risk factors. For dietary habit, which is actually increasing your sugar content, definitely it has a negative effect on the brain. So that increases the risk of your cognitive impairment and in later life, probably dementia.
As well, hypertension?
Hypertension, definitely, yes. Uncontrolled hypertension is also an important risk factor.
Coronary artery disease?
Yeah, that comes in the vascular risk factors, yes.
Absolutely, okay. So what are some of the treatment options that we consider when a patient comes to see us, typically at our office?
So before we go to the treatment option, as we mentioned, like we have to look at if they have any treatable cause. So obviously the treatable cause need to be identified in the early stages, and it can be treated like hypothyroidism. If the patient we should start a supplement. If they have a severe vitamin B12 deficiency, it needs to be treated. And also look at their risk factors. If they're consuming large amount of alcohol, we need to advise the patient to stop drinking, or drinking probably in moderation or less. And also look at their medication, because as we know, like benzodiazepine or other psychotropic medication has a negative effect on the brain. So we have to try to wean them off slowly from the medication and see if their cognitions improve.
And not just benzodiazepines. I mean, we're also seeing a lot of opioid use sometimes.
Yes.
And opioid use, also opioids, you build tolerance to opioid, and over time patients get more and more, and we see some of that as well in our office.
Right.
Where weaning them off of that also improves their cognition, correct?
Right. Yeah.
Okay.
And another non-pharmacological treatment, we always talk about exercise, because we know exercise is very important. So exercise is physical form, physical activity, and also mental exercise that we can do in forms like, I usually recommend patients doing like crossword puzzles, Sudoku. If they like reading, reading is also a good habit, okay, that improves your cognition.
Right, and reading improves it to a certain degree just because it's not being tested on the other side. Comprehension is not being tested in our patients. So cognitive training, I think they find more benefits in puzzles, like you said, and other physical exercise, of course, is really good as well to improve circulation. Brain health is directly correlated to heart health, and so all of those are freebies always that we talk about, as well as the healthy lifestyle, correct?
Right.
I mean, and the fourth thing also is to consider is a social activity. Correct? Like, staying active socially, that continues to keep you happy. And, if we're not depressed and not anxious, we think clearer.
Right.
So, and then we also, always talk about what are the other options that we have medications wise. I mean, that's something to consider, but that's the last resort type of a thing. So
right now, medications currently not recommended for mild cognitive impairment. We usually treat patients with the diagnosis of dementia. So that's a slightly advanced stage from mild cognitive impairment. But there are studies actually showing that patient, it's all like retrospective trials, which shows the patient who use non-steroidal anti-inflammatory drugs, they have slightly lower risk of cognitive impairment. But doesn't mean that we ask our patient to start taking NSAIDs because the risk of side effects of the medication, and it's not been studied on a long-term basis.
Absolutely.
Yeah.
Even though, so that brings up a good point. So non-steroidal anti-inflammatory medications are not the same as the anti-inflammatory diet.
Right.
That is a key. You know, so anti-inflammatory diet is indeed good for the patients, and that includes diet high in omega-3 fatty acids.
Right.
You know, and that could be, and fats can be anywhere from coconut oil, sunflower seed oil, olive oil.
Right.
Lots of walnuts, almonds, chia seeds.
It's all in the Mediterranean diets.
Absolutely. Rainbow diet, lots of macros, micros, all of those are good for them, and they're all part of the whole anti-inflammatory diet. But non-steroidal anti-inflammatory medications are a completely different game, as he said.
Not recommended. Yeah.
Not recommended. And what are NSAIDs? What are some of the NSAIDs? Like
Motrin, you can have ibuprofen, Mobic.
Right.
Yeah,
so,
naproxen. These are some of the anti-inflammatory medications.
Yeah.
Now, there are certain other medication which is in the therapeutic basket, like these are all research trials, like use of short-term use of transdermal nicotine patch, intranasal insulin spray, and growth hormone. But again, these trials were conducted over a short period of time, over less than 20 weeks, 4 to 6 months, and very small amount of patients. So the slight improvement in cognition, we don't know. We are not promoting these therapeutic trials because we don't know what is the long-term outcome of this, because they need to study to be successful, they need a large number of participants, and also it needs to be carried out longitudinally to see the risk and benefit.
Absolutely. Okay. Well, so that sums up what we wanted to talk about today, you know, in regards to cognitive impairment. So cognition is very important for us, and if we start seeing signs of impairment or lapses, if you will, memory lapses, brain fog, that's another subject that we, you know, brain fog, cognitive impairment, memory lapses, those are all interchangeable terms, but they shouldn't be taken lightly. Talk to your physicians about evaluating for those conditions, and also, you know, talk about, you know, and look at and evaluate what we need to do to improve that, you know, whether it's non-traditional or traditional methods, therapeutic methods, and, you know, everything else that, you know, we talked about, lifestyle, exercise, as well as the diet, the special diet that we talked about, Mediterranean diet, yeah, anti-inflammatory diet. And so those are some of the ways that we can improve cognition without starting medications. Thank you guys for joining us today, and please like and comment. If you have any comments and any other questions you'd like addressed, please ask. Thank you.
Bye.
Thank you, Dr. Agrawal, for joining us.